Good afternoon. Thank you for joining us today. My name is Terry Belcourt. I'm a registered nurse at the SRNA. Today I'm helping facilitate our presentation by Carmen Berglund. She's repeating a presentation that she gave during the conference in Regina this year for the SRNA annual meeting and conference. And I'm going to try to say the word. She's given me a tutorial. So Nisohkmatowak, something like that. Helping each other. So thank you so much, Carmen, for joining us, and I'll turn it over to you.
You're very welcome, and thank you for allowing me to repeat this presentation so that it'll be available for other registered nurses whenever they get a chance to look at it. And you said the word just perfectly. So I will tell you what Nisohkmatowak means, how we figured out this word, chose the word, what Nisohkmatowak is, the process of Nisohkmatowak. I will talk about reconciliation, a common word we hear, especially this year with National Indigenous Peoples Day and other things in the news, involving reconciliation in your daily work. And for me, in the area of kidney health and chronic kidney disease prevention and management, why this approach or theme has worked well for us in this chronic disease world. So before I go any further, I want you to think about how you react when your clients or people that you work with, whether it's in hospital, at an outpatient clinic, out in communities, any area you work in, how do you react when those people don't follow your advice and instructions? Because we all know what happens. We've all experienced someone who doesn't. It seems very easy for us. This is the way it is. Follow my advice. You'll have favorable results. Do you feel frustrated? Do you not get frustrated, but just keep teaching the same thing, hoping they comply? Because some of us maybe believe or we remember that we need to hear things many times before it really sinks in. Do you always ask the client or the patient what's important to him or her and then use that to plan the care, to plan how you're going to deliver care to that person, education, any follow-up visits? Or do you just look around for another job where it's easier and you'll find clients that always listen to you? Nisohkmatowak is the Cree word for helping each other. So when my program chose this word, it was in collaboration with many colleagues of ours in the First Nations and Métis Health Services Department for the Saskatoon Health Region and their representative workforce. So this involved many weeks of these people, these friends of ours and colleagues of ours, consulting with each other, and then they chose this word that they felt kind of encompassed our work together as departments, what we would be doing for the people that we serve, how we would be helping them, but really by them helping us first, I guess. So it's important and means a lot to individuals of particular cultures when you can incorporate just a simple word like this from their language into your work. If you work with a lot of immigrants in their population, figure out something, figure out a greeting or a word to refer to something that might make them feel more welcome. And this is just an example of that. We work a lot with First Nations and Métis people, Indigenous people in this province, and therefore we're trying to incorporate a lot more cultural aspects to help people feel more welcome in our spaces when they visit us, and to be more accepting of that when we are welcomed into their space. So this really is the perfect patient-centered approach. When you work in community-based chronic disease programs like I do and my health educator that works with me, you always have to look for ways to make your methods of teaching better. My program is special in that we're just 2 people, and we work to promote awareness of risks, causes, and management of chronic kidney disease to all age groups, all education levels, and any and all communities in central and northern Saskatchewan. That can be a really big job, so we have to try to reach as many people as possible with as few resources as possible, and still provide the best education, screening, and care that we can. So a key component of this is always going to be partnering with and forming relationships with other organizations. And even the community in which you're working, whether it's a neighborhood in your city, whether it's a northern remote community or somewhere down south, it really doesn't matter. That's how you make things happen. More people is farther reaching, more powerful, and is always going to be a critical component of serving our patients and clients and getting to the root of what they really want and need. I would like to now show a video that was made at one of our workshops that will summarize better than I can even say in words what the Nisohkmatowak process is all about.
Nisohkmatowak is about working together. It's about helping each other, coming together cooperatively to say, okay, how do we do things different than we've always done? And how do we get to that root cause and figure out what is causing this within a certain population group to make it different?
I think the value of the Nisohkmatowak workshop to me was the chance to actually hear from patients and families what matters to them. Sometimes as healthcare providers, I think we see with a certain lens based on our training. And I think this gives us a chance to take a step back and make sure that what we're doing really meets what it is that patients and families want. The improvement team has actually gone out to the communities, Pelican Narrows, La Ronge, going and actually seeing where people live and what it actually takes for them to travel into Saskatoon. I think we need to do more work in those communities in terms of taking our staff there as opposed to making the patient and family come here into Saskatoon.
We have gone to the communities to work with individuals in teaching about prevention of kidney disease. So there were already several relationships built.
You know, coming to us, coming to be with us, to help us, I think would open a lot of doors for our people. A lot of people won't be afraid to go out and seek help.
This particular strategy that's being proposed by Kidney Health will allow our kidney patients to be able to share their journey in terms of what are some of the best practices to incorporate for their own health and well-being.
What I like about this is that we're actually trying to create a plan and a solution for the long run and the future of Indigenous health for the renal patients.
We are 2 people here from one community, and we'll go home and we'll talk to our family and our friends, and then hopefully a workshop will come to La Ronge again, and instead of 10 or 12 people attending the first one, maybe there will be 50 people, and more people are going to get involved, and then it's just going to explode, really.
We know that Nisohkmatowak approach works. We know it works because we keep getting invited back.
They're working so hard to be so sensitive and accommodating that I think everybody's going to want this health care no matter what.
So as you can see in the video, we held these workshops in Saskatoon at Wanuskewin Heritage Park, in La Ronge, in Meadow Lake, and Pelican Narrows. With our consultation and guidance, similar workshops have been held without us being physically there. We also use the concepts of Nisohkmatowak in our daily work. We were advised by our friends and colleagues in First Nations and Métis Health Services to use some of the Truth and Reconciliation Commission calls to action. As mentioned in the video, reconciliation is very important in guiding our work, and along with the Saskatchewan Health Authority's goal to provide the best patient and family-centered care possible, these are now forming the basis of our work. And we do share this with other people that we work with from other organizations and people that we end up partnering with to do to farther reach and provide sources in the communities, such as health workshops and health fairs and things like that. The first call to action is that, wait a minute, sorry. The Truth and Reconciliation Commission of Canada released the document Calls to Action in 2015, which lists 94 action items to redress the legacy of residential schools and advance the process of Canadian reconciliation. So out of those 94 action items in healthcare, there are only a few that we can bring into our work and that really apply to us with our career, with our jobs, with the programs that we provide. So of the 7 items under the health section, we addressed 4 of these in our Nisohkmatowak workshops. Item number 19 is to identify and close gaps in health outcomes between Aboriginal and non-Aboriginal communities. Item 20 is to recognize and respect and address the distinct health needs of the Métis, Inuit, and off-reserve Aboriginal people. Which this means not just on-reserve individuals. There's more to the item than this, but sometimes it's taken a bit out of context. Item 22, Part 3, those who can affect change within the Canadian healthcare system recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders. And item 23, to provide cultural competency training for all healthcare professionals. Obviously, you are not able to answer this as a poll question, but I want you to think about this or reflect back and think about in your work and in your workplace, are you confident, or how confident are you that your workplace is actively addressing one or more of those TRC items that I listed and described on the previous 2 slides? And there's no right or wrong answer to that, but sometimes we're doing a lot more than we think, and sometimes there's a lot more opportunity to do more and do better than we have been. What's been happening in your workplace? Think about things that you've done for continuing education. Think about ways that different cultures are welcomed and greeted in your workplace. Is there a smudging room at your hospital? Is there translators for new immigrants that are living in your community that you would be able to better assist and teach what they need to stay out of hospital? Have you taken a course through a post-secondary school or online or something like that to understand better Indigenous culture and history? At your hospital or clinic or in your town or city, have you raised a reconciliation flag at your hospital? Those are just some examples, and examples of things that we have done here in Saskatoon at our healthcare facilities, and that for me in the kidney health program we've done in our program. I will now show a video that will help you better understand the positive impact this has on our patients and families. And it will confirm why what you're currently doing or have plans to do in the future are so important to the health and well-being of Indigenous people and all other groups of people as well. And
with the patients and families' voices today, we were able to pick priorities and look at how we're going to actually move forward. Some of the things we can actually do right now, some of them more short-term, some long-term. I think the other value of the work is we're really trying to not worry so much about boundaries, but really what is the service that we need to provide for that patient. And I think it is the voice of the elders that truly have guided our work.
The 94 calls to action by the TRC in that, we said, how can we implement this whole process into those calls to action? What we're doing now is a call to action by implementing and following First Nations culture, by starting in a good way, and that was beginning with prayer. To me, that's, as a survivor of the residential schools and that, you know, for an organization or an agency to do that, you know, that's them telling me, yes, we care about you and what was taken from you and that.
I think if you respect another person for who they are and what they practice, no matter what their culture or tradition or religion or faith or prayer or ceremony is, then you're going to give that person the best care you can give them, no matter where they're from.
The crucial first step is to having that dialogue. Because of that, it's going to open up more understanding between both sides, and because of that, I think it'll be a positive thing for everybody, for Aboriginal and non-Aboriginal alike.
As a region and as a hospital, we signed on to commit to address the Truth and Reconciliation recommendations, which includes really looking at how do we do what we do better in a more culturally appropriate way with the people we serve, and how do we work together to get to a different place than we are in essence. And it means working different than we have traditionally worked.
It falls right into the lines with the Truth and Reconciliation calls to action and the standpoints around health, and at the same time giving our patients on reservations a voice. This process is very valuable in the future moving forward. We're coming up with a plan.
so as you can see, this is a concept that's very well received by our patients and their families, and also healthcare providers in the communities that these people work. Nisohkmatowak, the process that we use, incorporates traditions, culture, and spirituality. It provides a safe, open atmosphere with an equal opportunity for everyone to share and learn. And people have told us so many times how much they have learned from each other, that they've never learned so much at a group event. And we were at first surprised because we didn't really have a teaching agenda for them. So then we really did start to realize the importance of gathering people together who have similar concerns and needs, and just let them share and learn from each other. Most importantly, though, the healthcare worker listens. And that word is underlined there. You listen, you don't talk, you don't offer suggestions. You might take notes when giving a question for the group to discuss to solve that problem or come up with ways to make it better. Our job is to not teach and talk. Our job is to listen and help facilitate more discussion among them so they can come up with creative ideas. Right from the beginning, Kidney Health Program has always incorporated suggestions from the First Nations and Métis Health Services Department and representative workforce. And that means when we have meetings to discuss upcoming events or new projects, we have an elder present. And if we can't have an elder present, we'll all take a moment to say our own prayers, silent prayers, wishing well to the people that we're working for and that we're serving, and that we have a good meeting and we're able to be productive and come up with some good ideas. We begin and end all those meetings with prayers, our work sessions, teaching events. We offer protocol to the elders we offer tobacco per protocol to the elders. If we are serving food such as breakfast, lunch, suppers, snacks, we make sure we serve traditional foods. And we have held a pipe ceremony before our 2-day workshops at Nisohkmatowak. Nisohkmatowak, that is a sacred site, and when we travel to other communities, we use appropriate facilities on reserve, such as a school gym or a hall, if there isn't something that is similar to Nisohkmatowak. We ensure the setting is comfortable for everyone and provides privacy for discussion of sensitive issues. And again, there is no judgment, and if it is something that starts to come up that maybe we aren't able to change or fix, but we know that it can and should be, we promise to refer that on to the appropriate organization who can help. And sometimes that's things like Health Canada or a town council, something like that. All participants are encouraged to share and are given equal chances to speak. There's opportunity to visit among participants and get to know each other. So at the start of the day, during breaks, we try to have other events along with it, gatherings where people can just visit on a personal level. And again, just keeping in mind about the healthcare worker being the listener. When we listen to our clients, we learn a lot more about what they need and what their priorities are, which can be very different than what we as registered nurses and any other healthcare providers believe or were taught. We're just trying to do a good job according to what we learned in school. And sometimes we need to let some of those ideals go. Some common discussions that we have had throughout all of our workshops. Discussions about patients being in charge. We need to help patients in the areas that are a priority to them. You don't get anywhere if there are other things that are priorities, but you still keep choosing on and getting stuck on another area that isn't a priority to them. Lifestyle challenges. They have lots of medications often, food and fluid restrictions. They're unable to work, they're exhausted if they have to go to dialysis, or they have other major chronic diseases. Support, everyone needs a healthy support system, but this means different things to different people. So just what we think might be what they need for support, not necessarily is that what's going to mean most to them. Trust, patients are not trusting of healthcare providers in general. The system has failed them before for reasons like residential school trauma, experiments, whatnot. There's a lot of fear. What will happen to me if I go to see this healthcare professional? What will happen to me if my kidneys fail? I'm scared of needles. I'm scared of surgery. I'm scared to travel from my small community that I fly in up north into the big city, and many more things. Waiting. Nobody likes to wait for test results to see specialists. to wait for an organ transplant, to get their dialysis treatment done. Comfort, things like long taxi rides, dialysis chairs, waiting rooms. There's a lot of little things we can do to make the experience more comfortable and less threatening for patients and their families. Family is another important issue. Not just one person's affected by things like kidney disease or other chronic diseases. It does become a family disease. You have a mother or a father that needs to travel 3 or 4 times a week into the city to get dialysis, just as an example, or you're doing dialysis in your home and you need a spare room available and pets aren't allowed in that room. The list goes on and on. Youth come up all the time. Everybody's worried about the youth, the young people. The adults and elders are afraid for the future of their youth, and they want them to be physically, spiritually, emotionally, and mentally healthy. They're worried about them not embracing traditions and teachings that their parents and grandparents once commonly taught to each other and practiced. And accessibility. Lots of things are not available when you live outside of a city. Even within a city, though, accessibility can be a problem for many. But especially the remote northern areas and places where when a grocery store burns down and isn't ever replaced, where do you get your food from? Water can be a big issue. Suitable drinking water is a luxury in many northern communities. Getting your medication and other healthcare services that aren't ever offered, and you have to wait to travel into another community. As I said, we can't fix everything, and there are some things that aren't even within our portfolio to work on and fix, but we always promise to do what we can and tackle what we can easily at first and move on to the next challenge. We forward those things that are not within our scope to all appropriate organizations. And be an advocate for your patients. Some other issues, people want more education and training for themselves and their communities, for their healthcare providers, and for healthcare providers, whether they're in a larger center or whether they're in their own healthcare clinic on reserve. Cultural training. It's clear that if healthcare providers had more education and training, this would make a positive difference in the care they give. Travel and transportation. It's a burden when you need dialysis. There's lots of appointments, not a pleasant experience for some. Environmental issues, I've already alluded to some of those, such as water or suitable living conditions. Traditional medicine. This has become a huge concept that we are trying to learn more about and trying to encourage others within our circle of care to embrace more and be more accepting of. Traditional medicine can and should be used, and all healthcare providers should learn about it and need to accept it. Understanding and acceptance by healthcare providers regarding our clients and their choices and their disease will go a long way. Communication issues, they always seem to talk about how information doesn't get communicated properly from one larger center to the smaller centers of the remote clinics. And we're always trying to find out better ways of doing that. And I think now that this is one provincial health authority, some of those things might be fixed. Might take a few years, but I think that we are on the road to a lot of good changes. Another important thing to note is that no matter how challenging kidney disease is or any other chronic disease that must be managed, we can always find something positive within our communities and in ourselves. So that is another thing that this Nisohkmatowak process is about. It is about assisting people to find what they have that's positive within their community. There's always something they can find to build on, to do better, and go from there. What are some of the key things we have learned as healthcare professionals in our program? We have learned to listen more and let the patient be in charge, to seek to understand all cultures and traditions, which will help us build better relationships with them and provide better care. We've learned that there is definitely a place for Western medicine and traditional medicine. They don't always need to be used together. If someone does want to use them together, we should embrace that and find a safe way for them to do it. And if someone wants to let go of and just toss out their prescription medications and go for traditional medicine, we also need to accept that as well and find a way to safely monitor them. We continue with our current work, but we seek to partner more with existing healthcare staff, educators, and elders from all communities that we visit. Some of the key milestones that I'll mention that are in my particular program. We have redone some of our handouts and pamphlets to make them a bit more user-friendly or reader-friendly and include a lot more pictures and simpler words. We include elders in our work in communities and presentations and things that we put on as much as we possibly can. Prayer, as I mentioned before, is a standard part of the start and the end of any kind of a gathering or event. We have done some continuing education courses on learning how to work more effectively with Indigenous people and other different sorts of cultures as well. We've started an annual memorial for kidney disease patients that have passed away and supporting home dialysis patients with education and tools to teach their peers in their home communities. That's a really huge one that some people who have now relocated to Saskatoon but are from a northern community and keep ties and contacts with their community that are often invited to come and speak about their experience, and we assist them and lend them out teaching tools and support them to do that. It's more effective to have the teaching done by them than it is by one of us, who is, number one, not a dialysis patient, and number two, not of Indigenous culture. We assist other organizations to restructure kidney health support for their community members. Other examples, we are in the future going to be making some videos that contain some English, Cree, and Dene in them. Don't know exactly what that is going to look like, but our patients and families will be working with us and assisting us to figure out what's going to have the biggest impact. And we're partnering with the Saskatoon Nephrology Group and the U of S to host large community health events in communities like Isle La Crosse and to work with youth in the future as well. That is all the information I have, and I hope that it has given you a lot to think about and things that you might want to try on your own, improvements you might want to make, taking the challenge on of trying to improve your workplace so it is a lot more comfortable and warm for the different people that visit it, no matter what culture they're from. If you would like to ask any questions or share any of your experiences, you can email me or my manager at these email addresses, or phone us anytime, or contact the SRNA and they can put you into touch with me. And that's all I have for today.
Thank you so much, Carmen. What a wonderful presentation. You've certainly piqued my interest and wanting to learn more and how to incorporate some of the principles that you've talked about. What were some of the resources that you really leaned towards and leaned on when you were developing this process?
I would say again, it is colleagues that we had become very close to in our hospital here in the First Nations and Métis Health Department, and other chronic disease organizations. In a department such as mine, there are many other areas that serve chronic disease education and disease management that are very small programs. and we have to work together. A lot of us do travel around and visit high-risk communities, and some of us are able to travel together to put on big events and work for a similar cause, up at northern communities. Just, over the years with those opportunities and that experience, you make a lot of close contacts, and many of those people can be key healthcare professionals in northern communities. They can be elders that everybody knows. Organizations such as Diabetes Canada, we've done a lot of work with, and we just know who to go to. I guess we know who to ask, who to go to, and we follow proper protocol. You can't go wrong. If you want to make an improvement to services and education for Indigenous people, for instance, find an elder, ask for a meeting, offer tobacco, and ask for their guidance. And there was a couple of elders we've done a lot of work with that we just began to trust that whatever they were going to say, that's the direction we needed to go in. And we still, even though some of those people are gone now, we still will reflect back and say, I know that elder would have wanted that, or remember this was what this elder said. So yeah, in the Indigenous world, you need to go to the elders.
Well, that is a great tip and a great suggestion for anyone who, and hopefully more people will be bringing those calls to action forward in their work life and really working towards some action items so that we can move forward in that reconciliation piece that we really do need to get moving on. So thank you so much for sharing your experience and your wisdom with us, and thank you so much.
It was my pleasure.